Hello friends, you know what? Around 70 to 80% of adult population have experienced some certain kind of chronic pain in their life, and many of these pains are not being treated well and patients are suffering, and many of the time patient doesn't know to whom to consult and who is the best person who can treat this pain. Myself, Dr. Ashu Jain, a senior pain physician, today will talk about when you see a pain physician for your pain. I am talking about chronic pain only. So first let's talk about and understand what is chronic pain. Chronic pain is any pain in the body which is more than 3 months of duration. It is affecting your routine life, it is affecting your mood, and it is not being going away by routine treatment. So it has many aspects: physical, social, psychological, emotional. So it has many components. It's not a simple pain. Chronic pain has lot of aspects, and when we talking about treating chronic pain, we have to treat all these aspects of the pain. Let's think about pain this way, that the most of the everyday pains like muscle pain, minor injury, posture related pain, they should improve within couple of days or maybe weeks. Most of the pain which are simple pain can be treated in 7 to 10 days with rest, stretching, basic painkillers and muscle relaxant, and they should go away permanently. But if the pain is not behaving like that, then that's the first signal that you should consult a pain physician. Now we will discuss in what are the common situations where you should see a pain physician. First and very common, I am suffering from back pain or neck pain and it is not going away. That means you have had a back pain for more than 3 months. It keeps coming back after temporary relief. You take medicine, it goes away till you are taking the medicine, but the moment you stop medicine, it returns back within 7 to 10 days, and it is happening again and again. Sitting, standing, sleeping, the routine daily works, they become uncomfortable. So this could be something like a chronic back pain or even some nerve related issue. So you have to see a pain physician now. Another important point, when you start feeling that pain has started controlling your life, so for that you have to ask very simple question to yourself, like, are you avoiding activity that you used to do routinely? Is your sleep getting disturbed? Is your mood getting affected? You are not able to do your job properly, it is affecting you, like you have a sitting work, you have a desktop job and you can't do that now, and you have to take regular leaves, it is affecting your job. So if answer is yes, this is no longer just a pain, it is something which is impacting your quality of life, and this is unacceptable. So you have to see a pain physician. Another very important point that we are going to discuss, you are taking regular pain medicines and they are not helping you anymore now. So if you are frequently taking Paracetamol, Brufen, some muscle relaxant and still not getting relief, or you are needing them daily, somebody is coming to your house and you have to travel or you have to do extra work, and in that apprehension you start taking painkiller in the morning because you want to get your job done that day. So what does that mean? This is called analgesic abuse, and you are getting dependent on analgesics for your daily work, and that means now these painkillers, they are not helping, and that is a sign that you need a more structured plan to treat your pain. And one is very important aspect that we have to understand: taking painkiller for a very long time will affect your kidneys. I see patients in my clinic who will take medicine, painkillers for years and years, maybe 5 years, 10 years, they are daily taking, or 2 times a week or 3 times a week. What is doing that? That is hurting your kidney, and particularly in elderly population and population with renal disease or population with diabetes and so on. So this is called analgesic abuse, and this is absolutely unacceptable, and it is making your life miserable. So in this situation you have to consult a pain physician. One more important point is the character of pain. The character of the pain is very important to understand and to know whether we need a pain physician consultation or not. If your pain feels different, like burning, tingling, shooting, pain like electric shock sensations, it is tingling or going down to your arms or legs, or traveling into your chest or into your groin, so on and so on, we call it as radiating pain. So if you have a radicular pain, like in lower limb, you call it as sciatica. So all these pain can be a neuropathic pain, and this is a pain which needs a specialized care. There is very difficult to treat a neuropathic pain with a simple painkiller, and usually there is a underlying serious problem that may hurt you in long terms. So if you are having a pain which has this kind of character, it's a neuropathic pain, and you definitely need a pain physician advice. Another very important aspect that we must remember, acute pain getting converted into chronic pain. Now what does that mean? You had an injury or you had a surgery where there was a trauma or a surgical cut to the body, or you have some gym injury, or you have fallen in your bathrooms or something like that. So all these pains are called acute pain, and they should go when your injury heals. Now most of the time the injury heals in 2 to 4 weeks, sometimes 6 weeks time. But if it is more than months, as I discussed previously that it is more than 3 months or more, and there is no active injury you see in your body, the actual injury has healed, either it was surgical or trauma, but the pain is still persisting or it is getting worse. So that means it is not a typical healing that has taken place. There is something else, and this is a concept. That means your chronic pain is now troubling you, and your acute pain has gone into a chronic phase. And if this is the case, you definitely need a pain physician advice. Another important question that you should always ask yourself when you are in a pain, that does that pain is affecting your lifestyle? So the real life signs, like you are avoiding long drives, you can't sit through a movie, you need to consistently change your positions if you have to sit for long, you stop doing exercise now because exercise is causing you pain. Earlier I see a lot of patients in my clinic where they were walking 5 kilometers, 7 kilometers, and now they are depressed because now they are barely can move 100 or 200 meters. So whenever pain is asking you to adjust your lifestyle because you can't do that anymore now, that means it is a chronic pain, and this is affecting your lifestyle. And if that is the case, it seriously affects your mood, your emotions, and I have seen patients going into severe depression because now they are really helpless and they are not being treated. So in this case you need a pain physician advice. Thank you.